Most COVID restrictions will be lifted in Saudi Arabia as the kingdom prepares for the Hajj season. And in Dubai, health officials are ordering residents who are diagnosed with monkeypox to quarantine for 21 days. With us now is Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter. Good evening to you.
Good evening.
So, where are we now actually with the pandemic? It's very confusing to many people.
Well, we need to keep our guard up because we've still got variants of concern arising. So in the United States, we have variant of Omicron B4 and B5, which is now starting to become the main player. And the way forward, the real good way forward is maintain our immunization, especially the vulnerable groups. And I think the time may also be coming to reformulate the vaccines to mirror the dominant variants.
Now, why getting excited over monkeypox? It's not a pandemic, is it?
No, not at all, and it shouldn't be, and it won't be. We should be able to control it, and we know a lot about monkeypox. It's not a new virus, but it is a new outbreak in many, many countries. But we know what to do. Identify, quarantine, identify the contacts, quarantine them, and we have the vaccines and we have the medication if needed. So it is not a pandemic, and it shouldn't become one.
Now, the variants you've mentioned seem to be very quick to spread and still are less influential or less risky than the previous ones. Is that a correct assumption?
No, because we are working under a background of a lot of people have now been immunized, and we get cross-protection, cross-immunity from the vaccines we used when we started using them. So whilst the variants are there, they are less nasty piece of work because most people, especially the vulnerable people, have been covered by the vaccines.
So what would be your best advice now for people?
My best advice would be don't drop your guard. You do not want to get serially infected because there are concerns that the SARS-CoV-2 virus may be a super antigen. What I mean by that is repeated exposure to it may trigger an autoimmune response, which then damages your heart, lungs, and other vital organs. So don't get infected. Don't drop your guard. Keep up to date with your vaccines. And to the vaccine manufacturers, I say, is it now time for you to reformulate your vaccine to mirror the new circulating strains?
Dr. Bharat Pankani, I thank you very much.